Hello friends, welcome back to my channel Dental Minibytes Basics to Mastery about all dentistry related educational videos. So this is the part 2 video of facial muscles. So let us go into the topic. Already we have seen some facial muscles, the continuity of the facial muscles. The next one is levator labii superioris. It has two heads, one is angular head and another one is infraorbital head. Angular head has its origin from the frontal process of maxilla. Here, the frontal process of maxilla and the zygomatic bone, and the infraorbital head from the lower orbital margin. So, both head arises from maxilla on the inferior margin of the orbit and get inserted into the alar cartilage and also the muscles of upper lip. So, the action of both part is the same, that is, it upper lip, elevates the upper lip, and the nerve supply for both part is buccal branch of facial nerve. The next muscle is levator anguli oris. It originates from the canine fossa of maxilla and gets inserted into the angle of the mouth. So it elevates the as the insertion in the angle of the mouth, it causes elevation of corner of the mouth, and it is also supplied by the buccal branch of facial nerve. Then the zygomaticus major muscle originates from the zygomatic bone and gets inserted into the angle of the mouth. So it also draws the angle of the mouth upwards during laughing and supplied by the buccal branch of facial nerve. Similar to major, minor muscle is also originated from the zygomatic bone, but it is inserted in the upper lip later to the levator labii superioris. Levator labii superioris will be inserted in this part. So lateral to this, zygomaticus minor is inserted, and the nerve supply is also buccal branch of facial nerve. Then the risorius muscle, this gets inserted in the skin at the angle of the mouth and originates from the fascia over the masseter muscle and inserted in the angle of the mouth. So it retracts the angle of the mouth backwards, and it is a muscle of grinning. Grinning is very important, grinning muscle. Then the nerve supply is buccal branch of facial nerve. Then depressor labii inferioris originates from the mandible between the symphysis and mental foramen and gets inserted into the lateral part of the lower lip, that is skin of the lower lip on the lateral side, lateral to mentalis. Mentalis muscle will be inserted over here. So lateral to it, depressor labii inferioris insertion is present, and the action is it draws the lower lip downwards and laterally as it is inserted laterally, so draws the lower lip laterally and downwards, and it is supplied by the mandibular branch of facial nerve. Then the depressor anguli oris, it is originated from the oblique line of the mandible and gets inserted into the angle of the mouth. So it depresses the angle of the mouth, and this is the frowning muscle supplied by the mandibular branch of facial nerve. Then the mentalis, it is inserted in the skin of the chin in the center, and origin is from the incisive force of the mandible. It raises and protrudes the lower lip and forms wrinkles over the chin area. So the nerve supply is mandibular branch of facial nerve. Then important muscle buccinator. It is originated from the outer surface of alveolar process of maxilla and mandible over the molar area here. Over the molar area, it gets originated on the outer surface and along the pterygomandibular raphe and gets inserted into the deep part of muscle of the lips. So the action is compresses the cheek, and this is called as the whistling muscle. and it is supplied by the buccal branch of facial nerve. So this is all about the muscles of face. Do enjoy the video, and please look after the muscles of face part 1 video also. Thank you.